It is reasonable to say that everyone has felt some kind of pain in their lives, and it is truly not a wonderful experience. Any pain at its most fundamental level results from a localized tissue damage. Acute pain is a one-time experience, while chronic pain, on the other hand, is different. It is ongoing and extremely incapacitating. Globally, pain is a major issue. According to estimates, 10% of individuals receive a new chronic pain diagnosis every year, while 20% of adults worldwide are estimated to have some kind of pain. However, the issue of pain has generally been a medical issue, but the public health has very seldomly addressed this. This is according to Goldberg and McGee in 2011. In this video, we'll be talking about analgesics, which is a drug used to treat pain caused by inflammation. These drugs either operate by lowering pain-related inflammation or altering how brain processes and interprets the pain. There are two main types of oral analgesics. One is the non-steroidal anti-inflammatory drugs or non-narcotic drug, and the other one is narcotic or opioid drugs. While opioid drugs are more successful on numbing pain coming from deeper organs, non-steroidal anti-inflammatory drugs are excellent for pain coming from skin, muscles, and joints. Some analgesics are sold without prescription, while stronger varieties, however, may only be obtained with a prescription. This is due to the increased risk of withdrawal symptoms, dependency, and addiction from strong analgesics.
Pharmacokinetics is what the body does to the drug, while pharmacodynamics is what the drug does to the body. Your body is full of nerve endings in your skin and tissues. Some of these nerve endings can sense pain. When cells in your body are injured or damaged, they release chemicals called prostaglandins. The special nerve endings that sense pain are very sensitive to this chemical. When prostaglandin is released, the nerve endings respond to it by picking up and transmitting the pain and injury messages through the nervous system to the brain. They tell the brain everything about the pain, like where it is and how much it hurts. So when you take analgesic drugs, it keeps injured or damaged cells from making and releasing prostaglandin. When the cells don't release this chemical, it means that the brain won't get the pain message as quickly or clearly. So your pain goes away or becomes less severe for as long as the cells aren't releasing the chemical. Acetaminophen works in the brain so you don't feel the pain. So analgesic opioids, also called narcotics, work by changing the brain's perception of pain. An opioid can be any drug, natural or man-made. Many are similar to morphine, but newer unrelated opioids have been created in the laboratory too. But take note that different analgesics work in different ways, such as opioids reduce the pain signals sent by the nervous system and the brain's reaction to those pain signals. Tylenol works by changing the way the body senses pain. Then NSAIDs block the effects of prostaglandins chemical in the body with hormone-like qualities, reducing both pain and swelling.
Analgesics are medications that reduce or relieve pain in a variety of ways. The central and peripheral nerve system are primarily affected by them. Analgesics include narcotic medications like betadine, synthetic pharmaceuticals like ketorolac, and non-steroidal anti-inflammatory drugs like salicylates, and a wide range of other drugs. The non-narcotic or non-addictive analgesics. The non-narcotic analgesics relieve pain by peripherally affecting the nerve system. Non-narcotic analgesics typically offer two additional qualities in addition to their analgesic effect: antipyretic and anti-inflammatory actions. Drugs in this class do not lead to physical dependence or narcosis, like narcotic analgesics do. The majority of the medication in this family, with the exception of pyrazolones and aniline derivatives, cause stomach irritation. Because of this, doctors frequently advise an anti-acid or anti-ulcerant when administering these medications. Narcotic analgesics. The drug known as narcotic analgesic have an analgesic effect in addition to causing sleep or loss of consciousness. In other words, medications that relieve pain by directly impacting the central nervous system, or CNS, are known as narcotic analgesics. Additionally, the word narcotic comes to mean addictive substances like opioids and other CNS depressants. The most widely used narcotic analgesics are opiates and their derivatives or opioids. These painkillers are also referred to as opioid analgesics in the US, like morphine, codeine, betadine, etc. Opioids are naturally occurring alkaloids that have been utilized for a very long time to treat the symptoms of pain, although they are the most common use for drug abuse. In addition, there are two main categories of non-narcotic analgesics: non-acidic and acidic analgesics. Non-acidic analgesics are acetaminophen and dipyrone are examples of some of these medications. These medications are most frequently used to treat mild to moderate pain. In most drugstores, they are typically offered as OTC or over-the-counter medication. NSAIDs or non-steroidal anti-inflammatory drugs are frequently mistakenly categorized as anti-inflammatory drugs. However, metamizole has a very different profile of antipyretic effect than NSAIDs. Additionally, the medication possesses spermolytic qualities. Acidic analgesics. The NSAID are the main members of this class of analgesics. These medications differ in their analgesic, antipyretic, and anti-inflammatory effects in addition to their chemical differences. These medications primarily function by preventing the COX-1 and COX-2 enzymes from producing prostaglandins. They do not, however, affect the lipogenase enzymes because they block COX-1, which shields the gastric mucosa from stomach acid. NSAID can lead to GI hemorrhage. Additionally, unfavorable cardiovascular events and kidney issue are linked to their use.
So what are analgesics used for? First is that it is prescribed after surgery to manage pain. Post-surgical pain is usually managed with multiple pain-reducing medications. The appropriate type, delivery, and dose of medications for you depend on the type of surgery and expected recovery as well as your own needs. Such examples are opioids, local anesthetics, and NSAIDs and more. So next is that analgesics is also prescribed for acute pain. Acetaminophen is the first-line treatment for most mild to moderate acute pain. Ibuprofen and naproxen are good first-line NSAIDs for mild to moderate acute pain based on effectiveness, adverse effect profile, cost, and over-the-counter availability. So lastly, for chronic pain. Chronic pain is pain that lasts for over 3 months. The pain can be there all the time or it may come and go. It can happen anywhere in your body. Therefore, medical management of chronic pain includes medicine management. Over-the-counter medicines may include non-steroidal anti-inflammatory drugs, NSAIDs, aspirin, or acetaminophen. Prescription pain medicines, including opioids, may be needed to provide stronger pain relief than aspirin.
It varies from severity between mild and severe. Alcohol consumption should be avoided by those who are taking analgesics because the two drugs may interact and a person who is taking opioids must be careful to avoid abruptly stopping because doing so can cause withdrawal instead. A patient should speak with their doctor about gradually weaning off the medicine.
Risk and precautions. The frequent chief complaint that clients have when seeking for medical assistance is pain relief. However, one of the most intimidating actions for providing care with pain is that each client may possess different tolerance levels. Due to this, a person with concern may require a larger dose than some in order to obtain the sufficient pain relief that the specific patient needs. Analgesics such as opioids and paracetamol are readily available over the counter along with other pain medications. Opioids is a well-known analgesic that is FDA approved for moderate to severe pain and started expanding during the 1990s due to health practitioners consistently failing to adequately manage severe pain. In addition, it is a common solution for patients with acute, cancer-related, neurologic, and end-of-life pain. Moreover, codeine, a type of narcotic analgesic medication, is a popular purchase and operated among all 3 jurisdictions. The factor of it being easily purchasable contributed to a spike in overuse, diversion of drugs, and overdose.
These medications are associated with increased risk of cardiovascular disease, renal disease, gastrointestinal damage, respiratory depression, abuse potential, and subsequent injuries. While most clients seem to have awareness of the risk, there is no evident impact on the avoidance of purchasing these products on a weekly basis. Thus, it can be said that the popularity of these medications is a possible indicator of misuse. The main issue appears to be that either medical practitioners undertreat, which results in unnecessary suffering, or they overtreat, which could have negative outcomes such as increased opioid analgesic use disorder and potential overdose. Hence, the reason why medical professionals must take part in the patient's pain management and understand the recommended treatments and safety concerns in prescribing analgesic drugs, such as opioids, as precautionary measures. This can be done through patient assessment and a suitable short or long-term treatment, planning, follow-ups, and continuous observations. How to take analgesics. Analgesic medications are often available over the counter, thus prescription is not necessarily needed to obtain pain relief products. However, certain types of analgesics may require prescriptions such as high doses of over-the-counter medications, combination analgesics, and all opioids. Moreover, analgesics are accessible in various forms including sublingual route, liquid injections through syringe, oral liquid, oral pills, tablets, or capsules, nasal spray, topical, or powder form, in which can be mixed in different ways. The best way to know what is the best route for you is by seeing a healthcare clinician to provide fact-based advice on what is the right dose to take and the duration of how often a client must take the prescribed analgesic.